Hello, everyone. Welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So in 2017, I launched Revitalize MD with a mission to help patients look, feel, and function better that traditional medicine just did not offer. I am a traditionally trained MD with a specialty in emergency medicine and practice for 25 years in the emergency room. During that time, I started to notice changes myself, and I wasn't alone. There were patients that felt that way, colleagues, and again, after all those workups, it was always the same answers. Everything looks normal. Then once I began my transition into anti-aging, I learned there were lots of different solutions. And so I wanted to bring those solutions to help patients look, feel, and function better. So welcome to the podcast today, and I hope you enjoy it. And I have a few guests here in the studio with me. Bella, go ahead and introduce yourself.
Hi, I've been with the office basically since the beginning. I'm a patient coordinator at the office. I just really love being able to work with Dr. Durst. I learn from her every single day. Even sometimes when I'm not working, I'll go on the social media and find out something new. I really look up to her, and she's really educated me just to how I can better myself. I'm only 22. I'm 21, actually. Getting a little ahead of myself. I'm 21, so I love being educated at such a young age, how I can be preventative and hopefully not look like a super old grandma when I get older.
We hope not. You won't.
Maybe.
And then I also have Samantha with me. I love having these girls with us because they can also give us the younger, version, the intro into it. We didn't know this stuff when I was their age. And so I love having them on because now they know it and they're ahead of the game and they're preventing at such a young age, and they're going to look beautiful forever. So Samantha, go ahead and introduce yourself.
Hi, I am Samantha. I have also been with Revitalize since we opened, and I'm the office manager, so I work very closely with Dr. Durst and her patients, and I make sure that everybody's care is the best it can be.
All right, so we are going to talk today about BPC157. We have done a podcast before about that peptide BPC157. If you don't know anything about it, then I definitely highly encourage you to go over to that podcast and learn more. We're going to do something different today.
Yes, so Bella and I did a little digging, and we found some patients that would be willing to talk about their experience with BPC. So we're actually going to get them on the phone and maybe one on Zoom so they can talk about their journey and their experience with the peptide BPC157.
Good. Well, these girls are very creative. That's why I keep them around, because they come up with ideas that I don't. And so, again, even for you, Bella, maybe talk a little bit about, how that comes and how we help patients in the office when it comes in a vial and we have to help them, reconstitute it and how that process looks like.
So whenever she first discussed that we were going to get peptides in the office, I kind of panicked. I was like, oh gosh, I've never even heard about anything like this before. But now I've definitely seen firsthand how the peptides have affected our patients. We've had patients lose weight. We've had patients that say they're able to move better. I can see a physical difference. I can see patients walking in and I'm like, wow, you've lost weight. You look great. I was nervous at first whenever they would walk in and I had to give them their prescription, and we can make it easier for you at the office. We give you your insulin syringes. We can reconstitute it at the office, or if you want to reconstitute at your house, either way, it's super simple. And I have no medical background, and it's still really easy for me to do. But it's a pretty easy process, and I don't like shots at all. But I did some of the peptides, and it's super painless, super easy, and I just love them, and I see how our patients love them as well.
And so one other thing you probably see frequently is even the tanning one.
Yeah.
It's pretty obvious.
We like the tanning one.
We love it.
Yeah, there's one that they can use for tanning, and we'll go into that in another podcast, but it allows you to get a tan, stay out of the sun, or even, tan a little bit in the sun, but not burn and minimize your exposure to sun. So anyhow, we'll go into that in another segment, but I know these girls like that, and that's definitely something you can notice with the patients when they walk in too. So, well, good. So we'll go ahead and get our first patient on the phone. And we're going to hear about his experience with BPC157. All right, so today we have a guest with us over the phone, and that is Greg Thompson. And Greg has been on BPC157, and so I was going to let him talk to you about his experience on that peptide. So Greg, tell me a little bit about the injury that you had and your experience with BPC157 on it.
Okay. Both shoulders from doing jiu-jitsu and boxing and lifting weights just took a toll. The activities took a toll on the shoulders after a while. They began to hurt and click, and I didn't have a lot of range of motion with them. And my strength was going down. And I read about BPC157. I got it from you. And I injected it into my shoulders and my elbows, actually. And I think it was like 2 weeks later, and I was back to lifting. So maybe there's just little bitty tears, little bitty, maybe even inflammation within the joint or whatever happens. But the BPC157, I swear by. I love it.
Yeah, and it's amazing. So if So over a period of a couple weeks, then you started to notice some improvement and at least could get back to being active again?
Oh, absolutely. Yes.
And
yes.
So
go ahead.
That particular area, were you injecting it close to the injury on each of those sides?
Yes, as close to the injury as I could. Okay. If I could pinpoint it, I would do on both sides of the injury.
And so what happens with that is it, decreases the inflammation, but also helps repair. And then there is some reports of it working better the closer you inject it to the injury. And that's been the case with you?
Yes, absolutely. Yeah, like I said, I was benching and I couldn't bench because of the pain. And I was convinced I had torn something in there. So I just laid off of the benching, which probably helped with the inflammation, and injected the BPC157 for 10 to 14 days. Actually, I injected it for more than that. I think it's 4 weeks, but at the end of 2 weeks, I was back to benching again with no pain.
Okay. And just so you know, Greg's downplaying his benching. Greg's intense and he works out hard, so he pushes it. So we don't have Greg. We have Greg over the phone and not in person. But if you saw him, you'd know what I mean. So
you're too kind with words.
So he was just downplaying that for sure. And it does kind of keep your body in prime condition, not to be injured. But again, as we age, right? We start to notice some changes.
Yes, absolutely.
We don't get...
And I think that kind of helps you stay in the game a little bit longer as well.
Mm-hmm. Yeah, and it doesn't... basically, we don't heal like we used to, right? We injure easily, and we don't heal like we used to.
Well, I guess with all the activity, that's inevitable, but I'll take that rather than being obese sitting on a couch any day.
Oh, absolutely. Well, I don't think you'll ever get there. Not even close. Nope. Not even close. But so have you used it and paired it with the CJC? You've been on CJC too.
Yes, I did. But I was not consistent with the CJC. So I don't really, actually, to be honest with you, I was going to call you and order more today of both BPC157 and the CJC. But I wasn't consistent with the CJC over time. So I don't want to, give a false report on that.
Well, and so Samantha's here, so she's making note to order that, just so you know. But also, so one of the ways that CJC, and I don't know if we talked about this, so I might as well just say it now, the ways that CJC and BPC work together even is that CJC increases your growth hormone, which is also a repair hormone, but does, everything testosterone does, but better as far as effects. But then BPC increases your growth hormone receptor sensitivity. So using them together improves the function of the growth hormone too. So, so they do pair well.
And that was my regret. that was my actual regret. And it didn't dawn on me until a couple of weeks ago. I'm like, I've got a major injury going on, and I should have been doing that all along.
And so if, again, I think with your intensity, you definitely work through any pain clearly, because most of us wouldn't even get to that level. We only can dream about that. But what we do with BPC, just so you know, so using it before any injury or before any surgery, around surgery, and after really helps improve healing times with surgeries. If ever those injuries get to the point where we can't repair, sometimes it's in lieu of surgery. But sometimes, because the orthopedic doctors will do that, the ones that are using peptides, and get repair, but sometimes they can't repair, something that's completely torn. And so they use it in conjunction because it allows that inflammation, but it doesn't let it go too far where you get impedance of the healing instead of improvement of it. So it does really help with any healing times around that. And then the other thing that we can pair after is TB4, which is another peptide for inflammation. So sometimes that helps decrease that inflammation, because after surgery, obviously, it's the inflammation and the swelling that really causes the pain and prolongs your healing time.
Oh, yes.
So that's
TB4. Is that the same thing as the TB500?
A little bit different. So TB4 is specifically, an inflammatory, and it's still injectable. But that'll help too, potentially after that surgery. So that helps decrease the inflammation and shortens your healing time. So just so you know.
That was like that laser that I had done in your office on the side that I have the tattoos. That worked well. That worked well for the anti-inflammatory effect.
And that was, we've done that one time. Was it one time now with you? Okay.
Yes.
And once. And that was the left shoulder, right?
Actually, I'm mistaken. We did it one time in the left, and I was supposed to get it 2 times in the right. I got it once in the right, and we had to reschedule one time, and I just never got back with you on the right one.
Well, and the reason that I love to pair the two together, and again, we didn't get that laser for, body treatments like this, but then it became obvious to us that it can work for that. So if there's point tenderness, we can direct the laser deeper into tendon, muscle, and joint, and it uses photobiomodulation to bring stem cells to the area, and then injecting, PRP, and using BPC and the peptides with it just help. They all work complementary. So
yeah, right.
Well, perfect. Well, good. And again, Greg works out way beyond us. And so, little injuries are going to happen as we age, and that keeps you in prime condition to not do it, or to not have it happen. But sometimes, those injuries and micro tears will happen anyhow. You didn't have any side effects, no other issues with it?
No, not whatsoever. Just inject it. You don't even feel it. And it's seductive. It sneaks up on you. The next thing you know, you're like, oh, man, I'm benching again, or I'm doing jiu-jitsu again, and there's no pain. And so that was the only side effect. I got healed.
Yeah, and the injections aren't painful because it's just a small insulin needle, so no big deal there either, huh? Well,
don't even feel it.
Well, good. We like those side effects, right?
Exactly.
Feeling. Those are perfect. So, perfect. Well, thank you for taking time out today to talk to us about that. And then we'll go ahead and order that, and we'll see you soon in the office, okay?
Absolutely. Thank you all, and have a great day.
All right. Thank you, Greg.
Bye-bye.
All right. So we have our next guest on the line, and we're going to let him talk to us a little bit about his story and also his experience with BPC. So I'm going to introduce Randy Doppler, and he's on the phone, he's on the screen, so you'll be able to see him, and he's on a Zoom call with us. And so welcome, Randy, to the podcast.
Hi, thank you. Good afternoon.
So You tell us your story first. You got an interesting story.
All right, I will. Thanks for having me on. Hopefully my story helps somebody out there that's listening today or watching. I was born in 1973, so I'm 47 years old, and I think age is relevant when we're talking about a product like we're going to be talking about today. So I was born in Oklahoma City and very early age diagnosed with bow legs. And so my parents were younger, and the doctor suggested that I have what basically is metal braces. And so in my mind, when Forrest Gump came out, I envisioned myself as a toddler wearing some sort of device or contraption on my knees for correcting whatever pigeon-toed and knee alignment issues I may have had as a child. And I'm sure with young parents in the 70s, it wasn't the most fun trying to put those on a toddler. So I'm not sure how long I wore those braces. Or how pronounced or extensive, even bow-legged and pigeon-toed I might have been at the time. So, like any other kid, I played sports all through elementary, junior high, and high school, whether it was soccer, basketball, track, football. I played just about everything. Did
you have the braces on the entire time? Did you have to play with the braces?
I actually, thankfully, I don't ever remember the braces. So I just have to take it on face value from my parents that they actually had them on me at some point. So.
All right, that's a good thing.
Like any other good kid, I
awesome, adventurous.
Yes, I guess so. But after college, I didn't play organized sports. I started doing what most people might do, and that's go to the gym and lift weights and exercise and just be fit. Maybe even some running, a couple of 5Ks. Here and there, not really like anything competitive or anything or regular, but I'd run routinely and go run a 5K once every great while. And when I was doing that, I never really had any issues of note. Like occasionally, if I had been running, 4 or 5 miles frequently, maybe once in a while, my knee would swell up. I just thought that was normal. That just happens to runners. At one point, I thought I was getting plantar fasciitis, and it was painful, and kind of like some people do, it just discouraged me from running. So I just pretty much stopped running. And that was kind of the first signs of, some knee discomfort.
How old were you when you noticed that?
I probably stopped running around the mid 30s. Okay. I'm going to say probably 2010, somewhere in that range. I just said, okay, I'm really not enjoying this anymore.
Yeah, too painful.
Yeah, my first true knee injury might have been back after college. We were at a sand volleyball place on a Saturday, just playing with some people from the gym. About 2 or 3 in the afternoon, a lot of fun. And all I was doing was walking over to pick up a volleyball that had been knocked out of the court. And with all the divots and the uneven terrain, my knee buckled. And I did like most people do, kind of hopped it off, walked it off, and then kept playing on it. And so for the next 10 years or so, let's say, occasionally my knee will pop. And when it pops, it feels like it's not popped out of place, but there's some tissue inside there that pops. And that'll be an aggravating, ache and persistent ache for a couple of weeks. And then randomly it will just twist or pop right back into the correct spot. And I'm new again, so to speak. Okay. So all those things led up to me buying the copper fit type knee brace. The thing that we always say: rest, ice, compression, elevate, and to rehab your knee. I was doing that. I would do icy hot from time to time.
Did you do this after? Would it occasionally get worse and you would do that, or were you kind of consistently doing that?
It would come and go as the aches and the swelling. If it was swelling, I would put ice on it. If it would ache, I would put like an icy hot on it.
Okay. When did you use the brace?
Okay, so the brace, that's kind of interesting here.
You pulled out the parents' brace all over again. You got it from the attic, huh?
Yeah, not like and I hate to reference Forrest Gump, but he did give us quite the visual in that movie. The bracing was probably about 5-6 years ago. Like to go on Sunday afternoons with my two boys and, some of our friends that we've played basketball with over the years and play for about an hour and a half, 2 hours at a church on Sunday. And that was really fun, but it started to get where my recovery time after that would be more than just that evening, but it would carry over 2 and 3 days. Mm-hmm. So I went to the academy and bought one of those knee sleeves that has the hole cut out over the knee. That's supposed to give you some relief for your patella. So I would wear that while playing. And then 2 or 3 days later, I would still want to wear that copper fit compression sleeve over my knees. Just trying to stay on top of it because I wanted to play basketball, but I didn't want it to carry over into our everyday lives. But it did, and it had. So, which kind of leads me to about 2018. I went to one of our local sports orthopedic clinics and had an MRI done. I really wanted to know, do I have damage in there?
Finally, we're going to get the answer, huh?
I wanted to know.
Yeah.
So they did an MRI, and after the MRI, I came back and found that I wasn't really a true candidate for surgical repair. There was some tears, maybe they were micro tears. I can't remember what he classified them as, but he said I was an excellent candidate for a cortisone shot. Mm-hmm. So mid-2018, I had my first and only cortisone shot because I am not a fan of needles. I'll just be upfront about that.
I think I heard that upon getting the BPC.
So what led to that was at night, I would try and sleep and I would toss and turn. I would try and put a pillow between my legs. My legs would just be aching. And then while I'm in Knoxville today and live in Knoxville, my office is in Chattanooga, and I do a lot of driving. My company, we operate from Central Florida to Indianapolis. So when we have meetings, if it's not, smart to fly, I drive, and it could be 4 to 6 hours driving, any given time. And with our main office in Chattanooga, I drive a lot of I-75, an hour and a half each way. And some days it just, sitting in that static position probably isn't great, but it does take its effect. So that kind of leads me to where after that cortisone shot started to wear off, how I got the opportunity to try BC.
So tell me this. So tell me, even the cortisone, works, but then it wears off after a period of time. And so it doesn't really solve or heal the problem then.
Correct. I think that the cortisone shot probably lasted with 8 months to a year, possibly a year and a half. I really felt like it was effective. But again, being 47, I don't think it's effective to do that once every year and a half.
Yeah,
I just don't think that's the right way to go. So I wanted to look and see what else was out.
Yeah, and it definitely can break down tissue over time with repeated injections. So, and you knew that part too, along with the needles. I'm sure with all the research you do that you find it's not a good long-term solution. So
he did tell me that the orthopedist did tell me that I have some level of bursitis, and then also some early, I don't know if it's an early stage or an early indicator of arthritis. So I know that, and it's, I have bow leg knees, and that. I don't know if that means anything medically, but I know long term it's not going to be great. I have to accept that. So it is what it is.
Again, daily pain, worse if you're not mobile with it and the flexibility isn't there like driving and so all right. And then you started BPC 157 recently.
Yes.
How has that been
the first
for you?
Or second week. Pardon?
How has that been? You said the first. Go ahead. Sorry, I interrupted.
Yeah, I think it was the first or second week in November. You get the little vial and you have to take shots. And again, I've said I don't like the cortisone needle, but that's a whole different needle. It's a very small, fine needle. My wife is an RN and she does a fantastic job of distracting me. So anybody that's got a fear of needles, I don't think it's going to bother you once you get used to it. But she does a great job. She stays on top of me receiving them and helps me out. So it's been going great. So I did the first vial daily. And then, we've decided to do this. We decided to put it on my right knee specifically. My right knee is where I had that pop. And it's the one that is a problem more often than my left. But I've really felt the mobility come back with less aches. For example, if I were to drop something on the floor, I don't have to really think about the way I'm going to bend down and pick it up.
Okay.
Now, the other day I was painting, and I was painting the baseboards. And so anytime you're painting the baseboards, you're on your knees the whole time. It's not a fun job anyway, but I didn't get up and have the discomfort and the pain that, let's say, last year I would have been experiencing, even after the cortisone started to wear off.
Okay, awesome. And then even I think being in that position as we get older, it's even harder to get up sometimes, right? From a kneeling position after a while. These girls don't know about that yet, but we get stiff.
Not yet.
And then you guys, I know that you were having pain on both sides, and you and Debbie have been playing around with, injecting it closer to the right knee, because there's some reports, no good studies, but there are some reports that show the closer to the injury it's injected, the better the results. And so have you noticed a difference on the right versus the left? I know you might have a little more discomfort on the right anyhow, but have you noticed a difference with going closer to the right knee?
Well, I'd like to say yes, but my knees equally feel better.
Okay.
So I don't know if that's consistent with what other people might report, but for me it is. Again, when I would sleep at night prior to starting this regimen, both knees were aching. If I were sitting in a meeting, I would have equal discomfort in both knees, sometimes more in the right. Like if my right one had popped, like I tried to describe earlier, oh man, it was way worse than the left. But I've not had a pop in a long time now. So I'm going to say 6 months or better. Seems like it was the summer before last, maybe. So I'm going to take those results. But I really feel like both knees are doing quite well right now.
Are you getting discomfort at night still when you sleep? Does it wake you up?
No, nothing like before.
Okay, good.
And that could be after a long day of yard work, working on cars in the garage, all those things that you want to do that you might limit yourself from time in doing it. I'm doing them now, and I've always tried to continue them, but with different outcomes. The outcomes previous might have been, a day and a half of body aches, whereas I'm just not having that right now.
You're not having it. So are you doing it now closer to one knee, or are you back to kind of just doing, because I guess there's no studies, there's some reports that you go closer to the injury and you get better improvement, but my argument still is you're going what's called systemically. So you're injecting it in subcutaneous, which goes everywhere. So are you back to just kind of doing it not, close to one joint or the other? We're
staying sub-Q, just like you said, on the right knee, on the inside of the leg, on the inside of the knee.
All right. Well, you're definitely
every time, same place.
Yeah, you're definitely in skilled hands, that's for sure. She may have even reported that you were doing a little dancing recently. I don't know if that's the case. Yeah. Oh, yeah. Maybe high knees was. I interpreted that as dancing, but maybe it was called high knees. Is that true? Is that true, Randy?
I'm more inclined to do high knees than dancing. I think I'd embarrass myself either way, though.
All right. So we won't request that you do it now then, right? On the Zoom call.
Thank you.
So you've been on it for 2 months now then, right?
Correct.
Okay, good. All right. Well, and how long do you feel like it took you until you started to see improvement?
Well, I wanted to see it instantly, right? Just like with the cortisone shot, I wanted to wake up the next day and say, all right, I'm good to go. I would say within about 7 days, I was really concentrating on it because I knew we were doing the shots. And again, I don't like shots. So it's, for me, it was similar to my allergy regimen when I first moved to East Tennessee and had to get a series of allergy shots. I wanted them to work instantly. I think within about 2 weeks, I started to say, you know what? I'm noticing results without having to try and find them. Like I really wanted to see and find that I'm having a result from getting the shots. But I think within about 2 weeks, I was like, you know what? I think this is starting to work. By the end of the first month, I was I was like, yes, this is definitely working. There's definitely a difference. So I went from optimistic and wanting to see immediate results to, I'm thinking we're close to definitely by the end of the first month. All right, this is making a difference.
And it's funny because, I always tell people with more regenerative or repair, we do a lot of regenerative stuff, and peptides are one of those, that it's not an immediate because it's regenerating. And anything we're regenerating, typically I say between 3 weeks and 3 months, we'll see improvement because the body has to do the work, right? It's not like traditional medicine. We give somebody a pain medicine and it immediately goes away. This is something different, and it's not a medicine, and it doesn't interact, and there aren't side effects, but also you don't get that immediate response. And so we try to set those expectations, but you're right. When you're having pain, you want results right away.
Yeah. And, I forgot to tell you earlier that I had bought the big bottle from Costco, the glucosamine pills, the tablets. I gave up. I tried them for like 6 months, and I don't think it was ever working for me. And maybe I bought the wrong brand or whatever, the wrong strength, but
well, it is.
Yeah, they're still sitting there.
Yeah, it's Costco. I mean, I always say, like, if a lot of people will get fish oil from there, I'm like, don't get the fish oil because it'll go rancid, and glucosamine is not like that. But yeah, so, and it's always good to use like a whole body collagen, whenever we're doing any kind of, joint repair. But, well, good. Well, maybe we'll get you in and even try the laser on him as well at some point. Maybe these girls can get you scheduled in, and we'll do the laser to each knee and just see if we can't do the laser and then, continue the BPC and see even better improvement. Because it uses a biophotomodulation, which means you're using that laser focus and light to bring stem cells to the area for repair, and then using the BPC. Maybe that'll work. I mean, we do it a lot on acute injuries. I'm not sure about more chronic pain conditions, but it'd be interesting to see for sure.
All right. Well, that sounds interesting. Maybe I can learn more about it too. Like the BPCs, I had no clue what they were or anything about them before you all introduced me to them.
Yeah.
So.
Well, I will say that the laser is not a shot. There's no shots involved at all. So that's a plus, right? I can promise
That's
you,
great.
No injections. So, well, good. Well, thank you so much for taking time out of your day and being on with us and sharing your story overall, and then your story with BPC and how it's improved, your pain and function and enjoyment. So thank you. Anything else you guys want to add, Samantha and Bella?
Oh, I do have a question. So since you're on your second month of it, and you said you started noticing results after the first month, do you think the results have stayed stagnant, or do you think they've gotten better, or what do you think since you've done it for multiple months now?
That's a good question. Before we got on here, I was kind of thinking the same thing. What kind of questions might you ask? And so continuation, I feel like if I was still taking the glucosamine tablets, I don't know what they would do because they never really worked for me. And then the cortisone injection we talked about a moment ago, it worked, it had an effective, and then it kind of arced and fell off. I don't feel that right now. So, in the last month or so since Christmas, I've not really noticed any tapering off effect. Like yesterday when I was painting baseboards, I really didn't have a problem getting up and down and, mobility wise. So I don't see it tapering off. So, I'm going to stay with it and keep going through the program and see where it leads.
Well, wonderful. Well, awesome. Well, we look forward to seeing you again soon. And thank you again for taking time out to talk to us about your story and BPC.
You're welcome. Have a great afternoon. Thank you.
Thank you, Randy. Bye. You too. All right. So we have another guest with us today over the phone. We're going to have a conversation with Lori. I'll let her introduce herself, and then we're going to talk about her experience with BPC. So, Lori, go ahead and introduce yourself.
Hello, all. Just driving to work here, so ask away.
Well, good. So Lori is one of our remote patients because, again, we do a lot of, either telemedicine or patients that are out of state and don't live here exactly. So, again, we can see them and treat them and get their medical history and at least see, once a year. But also we can have, peptides, shipped to you and even the hormones. So, but anyhow, so as far as BPC, Lori was on, another peptide, CJC, 1295 and epimorelin. And then we stacked BPC on top of that, not for an acute injury, but just for overall wellness and to improve the growth hormone receptor sensitivity of the CJC. And then she was on it for months, but go ahead and tell us a little bit, Lori, about what your experiences and how you felt or what improvement you saw after you started the BPC versus CJC alone.
Okay. Well, first of all, I do love the peptide program that you offer. I was on the BPC157 for a good 8 to 9 months, and I did have some issues, some shoulder, pre-shoulder injuries and a hip injury, actually a couple, and that's kind of why I wanted to try the BPC157. Definitely saw improvements with those, and I did it religiously. But the biggest thing is I had some low back issues, degenerative disc, sciatic issues from way back in my late 20s. And in that, had some really bad bouts with sciatica and ended up having to take lots of pain medication, Vicodin and others. And so over all these years, taking all those medications, even ibuprofen, Motrin, Tylenol, things, over-the-counter medications, it really damaged my stomach lining, gut lining, and I do take probiotics and prebiotics, and they help. And I, also had developed like GERD, acid reflux, from taking all that medication over the years. And what I noticed was an improvement in my gut lining. I mean, overall, the largest, biggest improvement was gut lining. The GERD, acid reflux, went away. And I did improve that with diet in years past, but nothing like what I truly noticed with the BPC157 is that, that gut lining gets damaged over the years, and, drinking alcohol, you over years, you notice that because, the next day you might have, some people might have hangovers, but also just headaches or just not feeling the greatest or whatever. You get that sluggish feeling. And I noticed after taking the BPC after a few months, nothing, not even a headache. I was actually completely shocked that all subsided and went away. Completely repaired that gut lining and, changed that overall. That was like one of the biggest things. Brain fog as well, clear thinking. But I, that was a huge difference for me personally.
And I knew that. You were taking it daily and just once a day?
I believe so. In fact, I had COVID in late October of 2020, and I had not taken, any of the BPC in, like a month or two. And I need to get back on it because I've noticed some changes since having COVID in, my brain, like sometimes cognitively can't remember things that are so simple. And it's been since, I think that's been the biggest problem for me as post-COVID is between not being able to get my total taste and smell back, but just sometimes cognitively, it's like people's names that I should know. I mean, easily sometimes don't come to me or a word. And I thought, I wonder, because I noticed that difference, just cognitively, with taking BPC, just very crisp, clear, no brain fog,
Yeah.
besides the stomach, gut,
And I always say it's like more of an executive brain function, Just even when you're on the CJC alone, and you're improving growth hormone levels in your body, that's going to improve brain fog. But the BPC makes those growth hormone receptors, especially in the brain, more sensitive to growth hormone. And so it's like executive, brain function improvement, or that's the level you'll be at, when you stack the two together, especially. So,
yes. I was just going to say, I planned on taking it for like the 6-month period, but then, I just kept staying on it. And then it was just holidays came around and I just kind of got busy and I fell off, and, you're home a lot because of the whole COVID issue and everything. But I do want to get back on it because I really do think it would help improve that, just because of what I saw and felt before with all of those things. So I would like to, get back to that.
Yeah. Are you still having taste and smell issues post-COVID?
I am. It was gone for totally for over a week, almost 2. And it came back little by little, but I still don't have the depth of flavor or smell that I used to. Something tastes off, or smell off. Yeah, it stinks.
Yeah.
Not quite, but I didn't have,
not
really,
it wasn't
bad.
I think it
have
stinks.
bad. What's that? Oh, yeah. Right.
Sorry.
Yeah.
Yes, that's a good point. But good. And it sounds like even the back, and the hip were better, on it.
Oh,
and
yeah.
then,
Yeah. Mm-hmm.
Are you feeling any of those areas having been off of the BPC for a little while?
No. And what would happen generally is, after I would get something where it would kind of improve, or there'd be a different kind of therapy, chiropractor or massage or just some other therapy to try to help it, just sleeping, certain pillows would affect, and it would start to come back in some way, shape, or form. But this is, it's been really good. Even coming off of it.
More consistent, long term.
Yeah. And I have noticed, though, again, I still think it's, post-COVID is, some of the stomach stuff come back, because I really try not to take any kind of, Tylenol or any, over-the-counter type medications unless I really, really have to. And during COVID, I just had more of the head cold. Really, I didn't even have a fever or anything like that, but just taking some of that medication to help alleviate some of that. I kind of want to get back to that BPC157 to kind of help the gut lining again.
Well, good. You listening to that, Samantha? Samantha's our go-to person. She'll work with you to get you back on it, right? She's your go-to person at the office for all things peptides or travel distance related, right?
Yep.
She knows that.
Absolutely.
Great.
Yeah.
Well, good. Yeah. Well, I'm glad that you took time out of your day then to, just help patients understand the benefit of BPC. And that was the peptide in particular that we're talking about. And we just wanted to get some patients on to talk about their experience with it. So,
absolutely. More people need to know about it.
Yes.
I keep telling everybody locally around me.
Yeah.
Because it really does make a difference. I mean, everything else I've tried that did not do what this does.
Yes. Well, and then I think the office thinks I'm crazy about it, because everybody that has acute pain, acute injury, stomach problems, almost anything, my go-to is BPC, instead of medicine. So, yeah, exactly. So, and now I'll add taste and smell to it, right?
Yeah. And I'll let you know once I do, return to it, I'll let you know how that.
Yeah, how that improves.
Is affected. Yeah. Yeah. Mm-hmm.
Absolutely. Well, good. Well, we'll let you go along your day. I know you're always busy, and I really do appreciate you taking time out. So thank you.
No problem. Anytime.
Right. Thanks. Have a great day.
Thank you so much.
All right. Bye.
Bye, guys.
Bye. Thank you, everyone, for listening to some of our patients talk about their experience with the peptide BPC157. I hope that it was educational for you guys, just to hear about what peptides can do for injuries, tendon issues, knee issues. So please, if you have any other questions about BPC, you can call or text the office to schedule a consultation to chat with Dr. Durst a little bit more. You can also follow along on our social media. for any more information that you may have.
And then again, like and comment. If you have any questions, you can leave them in the comment section below. Anything you want to hear about, because we're willing to deep dive into all things aesthetics and wellness. And again, we're here to revitalize your look, your health, and your sex life. Thank you.